Welcome to Virginia Medical Updates. My name is Alejandra Gonsalves. Today we have with us Farideh Abbasi. Farideh Abbasi graduated with her bachelor's in nursing from Indiana Purdue University with high distinction and went on to get her master's of nursing from George Mason University. As a nurse practitioner, Farideh has been able to blend medical and nursing therapeutics while maintaining a holistic perspective to manage and treat chronic health conditions, including cardiovascular disease, hypertension, and diabetes. Farideh has been practicing at Virginia Family Medicine since 2008, and it's a pleasure to have you here with us today, Farideh.
Thank you for having me tonight.
Our topic for today is diabetes, and when we last left off, Farideh, we were discussing lifestyle modifications on diabetes. And tell us a little bit about the considerations, treatment, or for diabetes management.
Sure, thank you. So as we mentioned before, the important aspects for the treatment of type 2 diabetes is lifestyle modifications.
Right.
For some individual with type 2 diabetes, lifestyle modifications are only needed in order to control their diabetes. And the diabetes can be controlled very well with those lifestyle modifications. For some individuals, although they go through all of these lifestyle modifications, but they still need to use medications for in order to control their diabetes. And for some people that they have complications, they need bariatric surgery in order to lose weight. But in general, those lifestyle modifications include weight loss, having a proper nutrition and healthy eating, exercise, regular exercise, and just go a little bit into detail of each one of these. Weight loss, the individuals that are overweight and obese, they're at high risk of having complications of diabetes if they are diagnosed with diabetes. So by losing about 5 to 10% of their weight, that can reduce the significance of the disease a lot, and it can actually improve their condition.
So great, it's something again that they're in charge of and in control. They're able to make that modification to be able to help the management of diabetes.
Exactly. So what we mean by exercise, when they lose about, about the weight, when they lose about 5 to 10% of their weight through exercise and healthy nutrition, that can really prevent the complications of the disease. And then healthy nutrition, which means having the foods that are low in calorie and fat, and the foods that they have a low glycemic index. By saying that low glycemic index are the foods that they have, usually when the foods are metabolized, they do not raise the blood sugar that high.
Are there some examples of those types of foods?
Exactly. So the foods like vegetables and fruits and high fiber, and they do not basically increase the blood sugar very fast. But of course, the foods like sweets and the really high calorie and high fat foods, they increase the blood sugar very fast, and that can increase or make the diabetes worse. So really, in each one of us, as we get older, we need to consider that we need to consume really good proportions of vegetables and fruits and grains. Do not eat that much animal products, and try to reduce the sweets, and maybe eating more basic fish, and which the foods that they have high omega-3 fatty acids that are really good for to control and reverse the diabetes. And then so again with the foods that they have low glycemic index value, and
high fiber as well. You mentioned
exactly.
What are some options for that high fiber foods?
And the high fiber foods, the foods that they have grains, you know, like multigrain bread, multigrain pasta, and
so whole wheat,
whole
right?
wheat and oatmeal. Exactly. One of the major problems in type 2 diabetes is insulin resistance. So by doing some type of physical activity, which means 150 minutes of moderate intensity, like jogging or
for
running.
the week, 150 minutes
Exactly.
for the week. Okay.
150 minutes per week of moderate intensity, activity, jogging, walking, running, and also some type of strengthening and resistance type of exercise,
Okay.
like yoga, weightlifting, about
okay.
2 times a week.
Gotcha.
So that can actually helps the individuals that are they have type 2 diabetes to increase their responsiveness of their cells in the body to the insulin better and reduce the impact of insulin resistance in their body and actually have increased insulin sensitivity in their body.
Okay.
So that it can reverse the condition with type 2 diabetes, having a regimen of regular exercise on a daily basis.
How about, so if those are the considerations that we have that they're in control of, being able to do the exercise and the food, what about medication?
So the medications also are part of the treatment for diabetes,
right.
because with only lifestyle changes in some individuals, we cannot control the diabetes, and we need to use medications. Of course, there are many different medications these days that are used for controlling diabetes, and one of the first row medications that we use for diabetes is metformin. Okay. Metformin is really good medication, of course, for people that they don't have any contraindications in terms of having kidney problem, kidney disease. Metformin is one of the medications that increases the insulin sensitivity in the body. So, and also reduces the production of the glucose through the liver. So we usually start off with these medications because it can also help with people that they're trying to lose weight to increase the insulin sensitivity. So it helps with the metabolism of the sugar.
Oh, that's
better.
great. So it's helping them to lose weight.
Exactly. And then there are other medications that have been used in the past, like the group of medication, they're called sulfonylurea, that they have side effects of weight gain and hypoglycemia, that we don't really, we are not willing to use them anymore because of these complications. And there are medications like TZDs that they can cause weight gain, and people that they have heart disease, we do not recommend to use them because of some of the major side effects in terms of cardiac side effects with these medications. And then we have basically the new group of medications that work on the incretin pathways. The incretin is one of those basically hormones in the gastrointestinal system that helps with the more secretion of insulin.
Okay,
so these medications, as they are called GLP-1 agonists and DPP-4, those are the medications that are also used, and especially the GLP-1 agonists, glucagon-like peptide 1 agonist, receptor agonists. Those are the medications that are also help with the weight loss, because that increases the satiety and in the individuals, and that not only it helps with the more production of insulin in the body, but also helps with the weight loss. And also, there are some group of medications in the GLP-1 agonists and with the metformin that they also have cardiovascular benefit from them. So as we know, one of the complications of diabetes is cardiovascular disease. So this medication actually helps to reverse the cardiovascular condition, metformin and the GLP-1 agonists.
So obviously it's really important to make sure to get to see your doctor or nurse practitioner to make sure that you're getting the right medication if that's the option for you. And so then tell us, we discussed the differences in age for diabetes. What about for race or ethnicity?
Yes. So as we know in the United States, so I'm considering the United States as the country that we all live with different races, and so all different races have been impacted by the diabetes. So in order to show you some of the numbers, I have a diagram here from American Diabetes Association that shows that basically these numbers, some from like American Indians or Alaskan natives, those are the people that have been impacted by large, with the diabetes. And about 15.9% of American Indians have been, influenced by this disease. And then we go to non-Hispanic blacks that have been, there is 13.2% of these individuals have diabetes or have been impacted by prediabetes and diabetes, and Hispanic Hispanics 12.8%, and Asian Americans about 9%, and non-Hispanic whites about 7.6%.
Okay.
So we have on the highest, top of the scale, the American Indians. There are a large number of people that they have diabetes, and the low on non-Hispanic whites.
Okay, so everyone is pretty much affected, but the percentage is a little bit, depending on your race or ethnicity, there might be a little bit more. Talk to us about, you mentioned the comorbidities or the co-occurring diseases that somebody might have along with diabetes. How does that impact the management?
So there are a number of comorbidities with diabetes, with type 2 diabetes, and one of them is, of course, is coronary artery disease. Okay. And coronary artery disease, which can lead to basically the heart attacks and a number of heart attacks, and also hypertension and heart failure. So the other comorbidities that come with diabetes, of course, is heart failure. And individuals that usually they're older and they have been impacted by the complications of the diabetes for a longer period of time, they experience also heart failure, and those are the people that they have recent hospitalizations because of the complications of the heart failure as well. And also hypertension is another, and there are a number of people with diabetes that they also have hypertension, and their hypertension also needs to be treated. Right. And also there are other complications like end-stage renal disease, chronic renal problems, liver disease, strokes, amputations, blindness, dyslipidemia, so psychiatric problems, some type of cancer. So they're all comorbidities and complications of diabetes.
Okay, and so just in conclusion, Farideh, tell us, what are the future considerations for the United States, since obviously this is a big issue in our country?
Yes, as you mentioned, diabetes really has a huge impact on the healthcare, on the lives of the people. So just considering the diabetes as really a public health problem that has pandemic proportion throughout the world and in the United States. And concerning the complications of this disease, that actually with increasing healthcare costs and expenditure, that is staggering, and really put the healthcare system that is already overwhelmed with so many issues and putting a lot of burden on the healthcare system. So it's really important for us to consider that we can control diabetes in terms of the healthcare providers and also patients that they have diabetes. We can control that. We can reverse type 2 diabetes by really, very simple steps, by our lifestyle changes. So in terms of the healthcare providers, really are encouraged to, or really are advised to encourage their patients to do regular exercise every day, to be on a proper nutrition, and also to try to keep their weight under control. And also, as an individual that has diabetes, it's very important to consider and practice these simple steps in their life in order to prevent the complications of this disease and in order to have a much better quality of life.
That's great. Thank you so much. And of course, it's something that's really important and something that can be followed by you there as our nurse practitioner at Virginia Family Medicine. So thank you for making this a point so important to us. And thank you for joining us here at Virginia Medical Updates. My name is Alejandra Gonsalves. Our program today has been brought to you by Virginia Family Medicine. Virginia Family Medicine integrates alternative and functional medicine in their practice to complement their expertise in medical care. Their areas of focus are in weight management, preventative medicine, and holistic health.